Hi, everyone. Good evening. I'm Sophia Philip. My pronouns are she, her, hers, and I'm coming here to work on this project with Chelsea McGraw with 7 years of experience in education, health research and prevention, as well as access to resources for marginalized communities. I'm a CMU graduate student in healthcare policy and management.
Hi, everyone. My name's Chelsea McGraw. My pronouns are also she, her, hers. I've worked for 10 plus years across the education sector as well within humanities, theater arts, dance, building wellness programs, and public health initiatives in school communities internationally. I'm also in the healthcare policy and management program at CMU with Sophia.
Thanks, Chelsea. So our project falls under the supervision of the Community Health and Wellbeing. So we plan to use our skills to optimize access to care and wellness services, whether it's student-led like Lean On Me, shout out to you all, we're really excited to connect with you after this event, or institution-led. And all of this, our CMU Cares project is in preparation for the Wellness Center, which is set to open in 2024 at CMU. It's an all in-house services providing mental health and wellness support.
Within an NIH-funded survey study conducted in 2020, about 71% of students indicated an increase in stress and anxiety rates due to the COVID-19 outbreak. And due to COVID-19's disruption to college campuses, students, they've been gone. So though they've mostly returned, residual isolation still impacts the CMU community, and it's felt. With the goal of unity, our hope is to rebuild connections through steady student engagement on a project that will also physically bring students together.
So CMU Cares, our initial phase 1 is to identify 50 students to gather in small intimate talks ranging from about 5 to 10 students to share their feedback and recommendations for CMU wellness initiatives. These interviews, we could call them motivational interviews or focus groups, will happen over the course of the academic year. And we're going to really be targeting to ensure we represent the diversity of both academic programs, but also of student identity groups and demographics. Lunch will be provided to incentivize participation, which is one of our items in our budget. And Tim, if you could share our flyer. This is currently our draft flyer that we're working on with the CMU Wellness Initiative, And you'll notice that we've actually added a QR code that will allow folks to not only sign up to participate in these events, but also start to allow us to collect data. And what we mean by data is, do students know what wellness services are available on campus? What are their thoughts on it? And is there something happening? Again, shout out to Lean On Me, that we could be learning about and better aligning systemically across campus to ensure the longevity of care. So we'll be using our funds, and the total we're requesting is $950 for both those lunches, but also to print these flyers, as we found that there are in-person gathering points where paper flyering still is impactful. We'll also be contacting student and faculty leads of student groups, honoring that we need those leadership in stakeholder communities to help better align us with who might be the enthusiastic participants that can really inform this long-term goal that will help build a more sustainable plan for wellness within the center. For phase 2, we're going to compile a report from this feedback, also known as an environmental scan, to present to leadership, and also to then figure out how can we design the optimal programming to ensure really a culture of care that's better rooted at CMU. And it also is an opportunity for us to identify students who want to actually continue and own this work.
And CMU supports an ecological model that recognizes population level and individual level determinants of health and intervention. So in honor of CMU's commitment to data-driven, human-led DEI work, we plan to use this ecological model as a guide, which will be adjusted to best fit our participants' needs. Our groups will be stratified based on demographic identifiers and interests. And the return investment of this effort is building an all-inclusive space that is student-led and collectively designed that embodies what wellness will be for our community. It's a space that for generations, we will be able to call ours.
So one of the long-term amplification moments was actually during this grant process. We were able to advocate for the need of work-study positions within the wellness initiatives at CMU. So it is not only will we be able to bring what we can in the short-term amplification, which I'll speak to shortly, but already we've laid down structural long-term impact in that in order to have student design work that really shapes the programming, it has to be student-led. And so right now our structure is starting to reflect that by having these work study positions kept in budgets and in departments like that of the wellness initiatives. So a short-term amplification is that final report I mentioned earlier. And so that'll be shared with leadership such as our new Dean of Diversity, Inclusion, Climate, and Equity, or other folks such as Associate Vice President of Community Health and Wellbeing. And these are the individuals sitting at the table deciding what will both programming and also the organizational design of the Wellness Center look like. And because we're coming at it in 2021, this gives us a really nice long amount of time to make sure we actually are collecting both deep and rich data. And really it's stories. It's the power of the stories reflected in the numbers that really will ensure that we're speaking to the entire CMU community. When I just want to add in also, we can potentially identify through participants, folks who would be interested in this work study position. So as part of it is instilling a practice of checking in with the community, but also making sure we're fostering connections with those who not only passionately care, but want to lead as well. And so with that, we're really excited to be considered again for our request of $950 for the really stage one of many stages of the CMU Cares project. And we open the floor to questions. Thank you all for listening and for everyone who's attending.
Thank you very much.
Okay, question time.
Well, Tim, I see why you ended with that one, the power of storytelling. Sort of rings an ear to what his mission is. So I think that's really brilliant and important in today's, and paying attention to the importance of that. They used to say, numbers tell, stories sell.
Mm-hmm.
I still say it.
Yep, you're right.
All
Hi,
right.
Sophia and Chelsea. I am so excited for your project. So much of what I did and what was meaningful to me in both undergrad and grad school was this peer-to-peer dialogue facilitation, both participating on both sides of it. I am curious about how you are preparing each other, yourselves, and anyone else that may be leading these dialogues for varying perspectives on what may be influencing the mental health of students. Understanding that this is in response to largely in response to everyone's isolation throughout the COVID-19 pandemic. We've all been isolating in very different situations. And so making sure that it is a safe space for everyone, I'm very curious what your process is to get that started.
And Taylor, thank you so much for asking this question. I think it really starts with doing an environmental scan and understanding the groups that we're working with a little more. I think the first step of the process is to listen and make sure that people are heard within this ecological model that also understands other factors and determinants of health and wellness. And Sophia, would you like to jump in?
Yeah, so to give a little shout out also to Chelsea's history and my own personal experiences, both of us have worked for several years specifically focusing on what I think traditionally is known as a trauma-informed framework of engaging in dialogue. So it can be in the discrete moments of laying down what are the community values when folks enter into the space, such as one of my favorites is the stories stay, the lessons leave, to ensure that students are promised confidentiality, which can be, yes, a medical practice, one held through HIPAA, but really it's something that needs to be normalized in all of our spaces beyond just healthcare. So that might be in the more discrete moments. And then also, as I mentioned earlier, it's trauma-informed care, but we're really looking to reframe it as the Wellness Center develops into resilience-informed care. So really ensuring that as we all come out and work through a very difficult time, we're framing it in a moment of how much strength that has been exhibited, but also honoring the vulnerability that we need to give at the intersection also of race, gender, class, nationality. Both of us have worked, Chelsea on an international setting, me on a national, working with different marginalized communities. I did a lot of advocacy work for LGBTQ+ care, undocumented patient access. Chelsea worked with a lot of refugee populations. So we're coming in knowing that we have to be mindful of what our presence will instill in this space, but also how to set up the structures to support those vulnerable stories.
And I think going off of what Sophia said, it's all about intentionality in our setup.
I'm moved by how thoughtful you all have responded to this and put this together. So I'm so excited to see this grow. And also, Sophia, I love your earrings.
Thank you. You've been getting some shout outs for your earrings from my folks who are here at this at the presentation right now.
They're awesome.
Okay, well, we are at time. Does anybody have Is there any problems with the amount they're asking for?
No, I think there's a problem with the amount they're asking for.
Oh, we have our first challenge. On the last one, we have a challenge from one of our judges. Wow, what do you see a problem with, Eric?
Well, I've built quite a few businesses, as you know, Tim, and when you're doing startup stuff like this, and I think often when you're planning, I call it the double factor in business. You know, if you think it's going to be 100, it's probably going to cost 2. And it just usually does. And that's how you come into budget from being out of budget. And generally, we just don't know what we don't know. And this is such a passionate startup, getting tremendous amounts of comments in the chats as I'm reading along. My challenge is, Tim, is I don't think they're asking for enough.
I don't think they're asking for enough either, Eric. So what do we do about that situation?
Well, Tim, like all other problems, you throw money at them. What do you mean? What do we do?
Well, I think we'll stop with our acting skills. We, after your interview, we felt like what you were doing was, like all of them, very important, but your dollar amount was not enough. So we are not awarding you $950. We are doubling that and throwing a little bit more change. And we are giving you the congratulations of the following award. And that is your award prize. You will be getting $2,000 instead of your $950.
Thank you so much.
Congratulations. I'm so excited to announce that your mentor is going to be Angie Lusk. Angie serves as the Program Director for Student Wellness Initiatives at Carnegie Mellon University. In that role, she educates and empowers student, faculty, and staff in cultivating individual and communal health and well-being. Congratulations.